Welcome. Today, we'll be discussing the top 10 habits that men can adopt to improve their health and well-being. We all know that maintaining good health can be challenging, but it's important to make our health a top priority. So, if you're a man or have one you care about and are looking for ways to stay healthy, you've come to the right place. In this video, we'll be covering 10 essential habits that can help men lead a healthier and happier life. From exercising regularly to getting enough sleep, we'll provide you with practical tips and advice that you can easily incorporate into your daily routine. So, sit back, relax, and get ready to learn the top 10 habits to keep men healthy. Let's get started.
1. Do regular checkups. Men should schedule regular checkups with their healthcare provider to monitor their health and detect potential health problems early. Regular checkups can include physical exams, blood tests, and other screenings as recommended by a doctor. Here are some general guidelines for how often men should schedule checkups. Ages 18 to 39. Men in this age group should have a physical exam at least once every 2 to 3 years, or more often if they have specific health concerns or risk factors. Ages 40 to 49. Men in this age group should have a physical exam at least once a year, and may also need additional screenings for conditions like high blood pressure and high cholesterol. Ages 50 and older. Men in this age group should have a physical exam at least once a year, and may also need additional screenings for conditions like prostate cancer and colorectal cancer. 2. Eat a balanced diet. Aim for at least 5 servings of fruits and vegetables per day, as these foods are rich in vitamins, minerals, and antioxidants that can help reduce the risk of chronic diseases. Choose lean sources of protein. Good sources of such include chicken, fish, tofu, beans, and lentils. Try to limit your intake of red and processed meats, which have been linked to an increased risk of certain health problems. Choose whole grain breads, cereals, and pasta, which are higher in fiber and other nutrients than refined grains. Choose unsaturated fats like olive oil, avocado, nuts, and seeds over saturated and trans fats, which can raise cholesterol levels and increase the risk of heart disease. Try to limit your intake of foods and drinks that are high in added sugars and salt, which can contribute to health problems like obesity, diabetes, and high blood pressure. Drink plenty of water and other fluids throughout the day to stay hydrated and help your body function properly. 3. Exercise regularly. Aim for at least 150 minutes of moderate intensity aerobic exercise per week, or 75 minutes of vigorous intensity aerobic exercise per week. Examples of moderate intensity exercise include brisk walking, cycling, and swimming, while vigorous intensity exercise includes running, high-intensity interval training, HIIT, and team sports. Incorporate strength training exercises at least twice a week to build and maintain muscle mass. Strength training can include weightlifting, bodyweight exercises, or resistance band workouts. Mix it up by varying your exercise routine to prevent boredom and work different muscle groups. This can also help prevent injuries and keep your body challenged. Exercise doesn't have to feel like a chore. Find activities you enjoy, whether it's playing sports, hiking, dancing, or taking a fitness class. In addition to formal exercise, try to stay active throughout the day by taking breaks to stretch, going for a walk during lunch, or using the stairs instead of the elevator. 4. Manage stress. Regular exercise can help reduce stress and anxiety by releasing endorphins, improving mood, and providing a healthy outlet for stress. Techniques like deep breathing, meditation, and yoga can help reduce stress and promote relaxation. Getting enough sleep is essential for managing stress, as lack of sleep can make it harder to cope with stress and increase feelings of anxiety. Taking time for self-care activities like reading, taking a bath, or spending time in nature can help reduce stress and improve overall well-being. Talk to friends, family, or a mental health professional if you are feeling overwhelmed by stress. Getting support can help you manage stress and feel more in control. Prioritize your tasks and break them down into manageable pieces. This can help reduce feelings of overwhelm and promote a sense of control. 5. Get enough sleep. Yes, getting enough sleep is crucial for men to maintain good health and well-being. Stick to a consistent sleep schedule. Try to go to bed and wake up at the same time every day, even on weekends. Develop a relaxing bedtime routine that helps you wind down before sleep, such as taking a warm bath, reading a book, or listening to soothing music. Create a comfortable sleep environment. Make sure your bedroom is cool, quiet, and dark, and invest in a comfortable mattress and pillows. Limit screen time before bed. Avoid using electronic devices, such as phones, tablets, and computers, for at least an hour before bed, as the blue light emitted by these devices can interfere with sleep. Avoid stimulants. Limit caffeine, alcohol, and nicotine consumption, especially in the hours leading up to bedtime. And again, yes, regular exercise can help promote better sleep, but try to finish your workout at least a few hours before bedtime. 6. Quit smoking and limit alcohol consumption. If you smoke, quitting is the most important step you can take to improve your health. Consider nicotine replacement therapy or prescription medications to help you quit, and talk to your healthcare provider about resources for quitting smoking. Excessive alcohol consumption can increase the risk of liver disease, certain cancers, and other health problems. Aim to limit your alcohol consumption to no more than 2 drinks per day for men, and take a break from drinking at least 2 days a week. If you are used to smoking or drinking as a way to cope with stress or social situations, consider finding healthy alternatives, such as exercise, meditation, or hobbies. Seek support, as quitting smoking or limiting alcohol consumption can be challenging, but it's important to seek support from friends, family, or a healthcare provider to help you stay motivated and accountable. 7. Stay socially connected. Join a club or group that aligns with your interests, such as a sports team, book club, or hobby group. This can be a great way to meet new people and develop new friendships. Volunteering for a cause that you are passionate about can help you connect with others who share similar interests and values. Attend community events such as festivals, fairs, or cultural events to meet new people and explore new interests. Make an effort to stay in touch with family and friends, whether it's through regular phone calls, video chats, or in-person visits. Social media platforms can be a great way to stay connected with friends and family who live far away, but be mindful of the time you spend on social media and make sure it doesn't replace in-person connections. If you are struggling with feelings of loneliness or isolation, talk to a healthcare provider or a mental health professional who can help you develop strategies for staying socially connected. 8. Practice safe sex. Use condoms correctly and consistently during vaginal, anal, and oral sex to reduce the risk of STIs and unwanted pregnancies. Get tested regularly for STIs, especially if you are sexually active with multiple partners or if you are unsure of your partner's sexual history. Consider pre-exposure prophylaxis, PrEP. If you are at high risk of contracting HIV, consider taking PrEP, a daily medication that can reduce the risk of HIV infection. Talk openly and honestly with your partner about your sexual history, STI testing, and contraception use. Limit your number of sexual partners to reduce the risk of STIs and unwanted pregnancies. 9. Protect against injury. If you participate in sports or physical activities, wear protective gear such as helmets, knee pads, and elbow pads to reduce the risk of injury. When lifting heavy objects, use proper lifting techniques, such as lifting with your legs, not your back, and keeping the object close to your body. Follow traffic laws and practice safe driving habits, such as wearing a seatbelt and avoiding distracted driving. Avoid risky behaviors, such as excessive drinking, drug use, and unsafe sex, which can increase the risk of harm. Staying physically active can help maintain strength and flexibility, reducing the risk of falls and other injuries. If you have a job that requires repetitive motions or prolonged periods of sitting or standing, take frequent breaks to stretch and move around. And 10. Maintain good hygiene. Shower or bathe daily to remove dirt, sweat, and bacteria from your skin. Brush your teeth twice a day and floss once a day to prevent cavities, gum disease, and bad breath. Wash your hands frequently, especially before eating or preparing food, after using the bathroom, and after coughing or sneezing. Trim your nails regularly to prevent dirt and bacteria from accumulating under your nails. Use deodorant or antiperspirant to reduce body odor and sweat. Wash your clothes regularly to remove dirt, sweat, and bacteria. Shave or groom facial hair regularly to maintain a neat appearance and prevent the buildup of dirt and bacteria. Doing the above will keep you more healthy, living a fuller and healthier life. Thanks for watching, and see you next week for another video.